Now let's talk about some important terms over here. What are cases? Okay, so let's talk about them. What are cases? Cases are basically, we are seeing that, usually when we are taking the rounds, okay, so we are generally asking to our mates, right, fellow doctors that, okay, what is this case, what is this particular case, okay, and they will be briefing about this particular case that, okay, this person came with this kind of provisional diagnosis and he was having this, that history, and what is the alleged history basically, what is the known complaints, right, and all of these things they are actually briefing us so that we can understand in short that, we will be getting idea about that particular patient, that what might be actually there in the patient, right. So what is the case basically? Case is having different types. Okay, cases are having different types. For example, clinical case or subclinical case. Then we shall talk about other kind of careers also in that particular term, right? So let's talk about the cases over here. What are the types? Okay, so types of cases, if you talk about, we are having basically clinical case and the subclinical case. They are very two on a broader level. We shall actually tell that there are two kinds of cases or two types of cases. These are your not the primary one. These are your clinical case and the subclinical case. So first one is your clinical case. Clinical. Okay. So first one is your clinical case. Clinical case, simple. Here we are talking about that yes, in this person disease is present. In this person signs and symptoms is present. Right? Signs and symptoms are present. For an example, a patient is actually coming to your OPD. Okay, coughing again and again. Right? Repeatedly he is coughing. Repeatedly he is having the hiccups. He is actually having the coughing. He is having the sneezing. He is having the rhinorrhea. He is having the the running nose is there, and there is conjunctivitis, right? All of these things are there. So this is kind of a upper respiratory tract infection, right? So this kind of picture is actually having the upper respiratory tract infection. So you will be having that idea. So this is the clinical case. Here the person is having signs and symptoms, and here the person is having disease as well. Okay. So if the person is actually coming to you where the disease is also present and where the signs or symptoms are also present, okay, or any other kind of IPD patient, it means that patient is already admitted to the hospital and you're just taking the rounds of your patients in the ward, for an example, right? So you are seeing that they're having the disease and they're having symptoms as well, for an example, signs and symptoms as well. Okay, fine. Next one is your subclinical case. What is subclinical case? So listen to me very carefully, guys. These terms are very important. They try to confuse you, okay, between these terminologies usually, right? Subclinical case means here the disease is at the suboptimal level, right? You might not see the signs or symptoms. Okay, so here you might not see the signs or symptoms. Okay, why is it so? Because the disease is at suboptimal level. So here the disease is at suboptimal level. Okay, for example, subclinical hypothyroidism, right? Okay, third one is your, what is latent infection? Very commonly this definition is asked, latent infection. Okay, or what do you understand by this particular latent infection term? Latent infection, basically this is that here in this case we know that there is a disease. Okay, so either the disease could be present, in some cases it might be absent also. Either the disease could be present, either the disease could be absent. Here the infective agent is present inside the body but not in an active state. Actually the infective agent is present inside the body but in the dormant stage. So basically infective agent is present but in the dormant stage. Okay, but in the dormant stage. Okay, here the infection is there, and whenever the immunity will be going on the lower side, this particular infection might be getting activated, right? So that is the particular thing here, right? But they do not transmit the infection generally. Generally they do not transmit the infection. They do not transmit infection generally. Okay, fourth one is your type, that is carrier. Okay, what is carrier? Right? So what is carrier? Carrier, basically here we are talking about the disease as well. Here inside the person, inside the host, infective agent is also present. Inside this particular host, the disease is also present, but signs and symptoms are not there. Okay, signs and symptoms are not there. So here basically, let me write as well. Here the person is not having the signs or symptoms, right? But infective agent is actually present in this body, right? Disease is also present in this body and it can transmit as well. So transmission can also be seen in these persons. Transmission can also be seen in this person, right? So they are kind of dangerous, right? They will not show the signs or symptoms, right? But they are carriers. For example, there were many carriers for the COVID-19. They're not showing the signs and symptoms. It seems that they are actually not having the disease, right? By looking at the first go, you will not be understanding that they are having the disease. They are asymptomatic persons, right? Or you might be asymptomatic in the COVID time, right? For example, you are saying somebody, yeah, I don't had the COVID actually. Okay, I escaped from the first wave, or I escaped from the second wave as well. Yes, that might be the case, but that might also be the case that maybe you were asymptomatic carrier, right? If you are a carrier, you might transmit the disease to others. For example, the perfect example you can take over here, that is a COVID-19, right? You might transmit this infection to the other people, but you in itself you are not having, you might not be having the symptoms basically, right? But it doesn't mean that you are not having the disease as well, isn't it? So that is the example of carrier basically, right? Okay, now let's talk about this particular term, that is a clinical case, right? In this particular clinical case term, we shall talk about some of the cases, right? For example, so let's brief it down over here. Come on guys, so over here let's talk about, okay, first case, that is what is your index case. Very important guys. So what is index case, what is primary case, what is secondary case? Primary case, secondary case, I hope you know guys, okay, but still, what is index case? Index case, basically we are talking about that in this case, this is the first case which is actually comes into the picture, or I would say the first case that is appreciated by any kind of investigator or appreciated by any kind of physician. So this is the first case which that comes to the notice, or which can be appreciated, that comes to the notice of an investigator, or you might say physician. Okay, for example, you saw first case of dengue fever, right? That would be your index case. Okay guys, that is just an example. Okay, B, what is primary case? This is the first case which is introduced in the community, right? This is the first case which is introduced in the community, the first case which is introduced, okay, first case of communicable disease which is introduced in the community or population, whatever you want to call. Okay, fine guys. What is secondary case? What is secondary case? Secondary case, basically the disease which is occurring from the primary case, right? So the one who develops the disease after coming in contact with the primary case, right? So case is, that develops disease after coming in contact with primary case, Basic idea is that you should understand what I am talking about, right? What is primary case? The first case which is coming in the community. Okay, from this first case, some other persons might get the disease, right? Or this particular case actually can spread to the other patients, right? For example, COVID-19, right? There could be one primary case. From this primary case, other patients were getting infected. Those were the secondary case, right? However, it is very difficult to identify this was the primary case and these person are secondary case, right? Everybody seems like they are secondary cases only. Okay, next one, what is suspect case? Okay, what is suspect case? It didn't came in your exam yet, but that might came. So that's why I'm taking this over here. That might come actually. The suspect case. Suspect case means this person is the suspect, right? Suspect means that he's having all the features of, let's say, COVID-19. He's having all the features of COVID-19, but yet to be diagnosed, right? So for an example, here what we are saying, a patient who has all the symptoms, okay, who has all the features of disease, but yet to be diagnosed, okay. So that is your, right, this kind of definition I'm writing in my own language. Okay, the main idea is that you should understand what these terms are actually having the meaning, right? Okay, so guys, after that, once we have talked about the cases, we have talked about the careers. Okay, after that, let's talk about what is attack rate and secondary attack rate. We have already talked about attack rate, secondary attack rate. Okay, because we are talking about the epidemiology of communicable disease as well. Okay, these particular infectious disease. So for that purpose, I'm just repeating over here. So guys, what is attack rate? Again, writing in the bold letter means it's very important as well. So attack rate. Okay, Basically, definition is important, guys, right? So what is attack rate? Total number of cases, okay, total number of cases in any area or in an area, right, divided by total susceptible population or total susceptible community, total susceptible community multiplied by any number. It could be, in the population it could be 1000 number, 1 lakh or some 10 lakh. Okay, so just writing 1000 over here. Okay, so whatever number, or 10,000, whatever number you want to add over here. So multiplicative factor, okay, depends on the population to population, right? Okay, on area or on the geographical distribution. Second is the secondary attack rate. Secondary attack rate. Okay, secondary attack rate basically is your abbreviated as SAR. SAR, this formula is very simple. Total number of, first of all, secondary case. In the numerator we are writing total secondary cases, right, in an area. Total secondary cases in an area divided by total susceptible community, total susceptible population minus primary cases, multiplied by 100. Here the multiplicative factor is 100. It can't be 1000 or 10,000 or 1 lakh, 10 lakh. It's not like that. In the attack rate I told you like that multiplicative factor can be changed, but here the multiplicative factor is 100. Okay, so usually they will be mentioning about the primary case, they will be mentioning about the secondary case, and you just need to calculate the secondary attack rate. Okay, I hope you guys are clear with that. Now I am moving on to, secondary attack rate. I already told you in the epidemiology class as well that it is an example of proportion, right? So it should be expressed in percentages or anything else. It should be expressed in percentage, right? So it should be expressed in percentages. Okay, so be very clear with that, because as it is an example of proportion, right? Okay guys, now what are the stages of carrier? We have talked about the carrier. Okay, we have talked about the carrier, right? We have talked about the index case, primary case, secondary case. We have talked about the clinical cases and all, right? But I think we haven't mentioned about the carriers, right? So let's talk about the carriers as well, guys. So here let's talk about the stages of carrier. Okay, so stages of carrier. Okay, fine guys. So some more important terms, let's learn about them as well. So in the carrier, basically there are two types of carrier. One is the temporary carrier and one is the chronic carrier. Okay, come on guys. So one is the temporary carrier, right? This is the temporary carrier, and another one is your secondary carrier, or I would say chronic carrier, not the secondary, I would say chronic carrier. Okay, first let me define the chronic carrier here itself, and then we'll talk about the further subtypes of temporary carrier. Temporary carrier is having more subtypes, right? So let me just define first of all what is chronic carrier. Chronic carrier means this particular case actually can shed the infection, can transmit the infection for more than 3 months, right? Chronic means what? More than 3 months, or sometimes we are talking about more than 6 months, right? Here in this particular case we are saying if some particular case is there, right? This particular case is there. I told you what is carrier, right? Carrier means it is having the capability of spreading the infection to others. So basically this kind of carrier, we are having two types of carrier. One is the temporary carrier, one is the chronic carrier. In the chronic carrier, I am saying that if any kind of person is having the capability, okay, he is diseased actually, is having the capability of transmitting this infection for more than 3 months, right? So ability to transmit infection, right? Ability to transmit infection for more than 3 months, guys. For more than 3 months, then it is also called as, what is chronic carrier? Chronic carrier is ability of any person to transmit this infection for more than 3 months, right? That is your chronic carrier, right? Now guys, I'm moving on to the temporary carrier. Okay, here we are talking about subtypes of temporary carrier. For example, first subtype which I'm going to talk about over here, that is what is incubatory carrier. Incubatory carrier means, as the name suggests, incubation period or incubatory carrier. Okay, so these kind of person can transmit the infection within one incubation period, right? So guys, the persons, okay, so in this case the person can transmit the infection, person transmits the infection within one incubation period. Transmits infection within one incubation period. Within one incubation period. Okay, right. Second, first was the incubatory period. It is coming under which category? Temporary carrier or chronic carrier? That is temporary carrier. Okay, guys. Second one is the healthy carrier. Okay, healthy carrier. Right. Healthy carrier, very easy to understand. In the healthy carrier, we are talking about person who is suffering from subclinical disease, right? Person who is suffering from subclinical disease, but actually he is not developing the overt disease. I mean that this person, okay, looks normal to us. Okay, this person looks healthy to us, right? But he might be having some kind of subclinical disease, right? He might be having some kind of subclinical disease. So if he is actually transmitting the infection, okay, however, okay, in very rare cases, he might transfer the infection or he might transmit the infection. So that is called as a healthy carrier, right? So he is apparently looking healthy, right? He might be having some kind of subclinical disease, right? So the person who is having subclinical disease, these are the healthy carriers. So persons, okay, with subclinical disease, right, without developing the overt disease, right? That is called as the, without developing the overt disease, that is called as the healthy carrier. For example, overt disease is, okay, overt, right? We generally use it for, like, for example, overt diabetes. Fine. Third one, guys, which we shall talk about over here, that is the convalescent carrier. What is this convalescent carrier? This means convalescent, what do you mean by convalescent? This means your recovery period, right? So the persons who can transmit the infection during recovery period, that will be the convalescent carrier. Okay, for example, the person who is actually recovering from the COVID-19 still might spread the infection, right? Still might spread the viral infection COVID-19. So that is your example of convalescent carrier, right? So here we shall write that, right, persons who can transmit the infection in recovery period, guys. In recovery period, then it is called as your convalescent phase, right? Or convalescent carrier, isn't it? Okay, guys, we're done with that. Now let's talk about very important thing over here, that is the modes of transmission. Come on, guys. Now let's talk about very important topic over here, that is the modes of transmission, right? So usually the infection is getting transmitted through lot of ways, right? And now we're going to talk about them, modes of transmission basically, right? So guys, whatever information I'm telling you over here, try to engulf it first of all and try to apply it in your clinical practice as well, in your clinical postings as well, or in your internship as well, right? Or while seeing your patients, right? So if you will be knowing these kind of terms, it will be very easy for you, right, to understand the medical terminologies which you are seeing in the basically files and all of these things, right? Okay. And for an example, if during the rounds, if the consultants and the senior residents, okay, they are using these kind of terminologies, okay, in case, then you shall understand them easily, right? So that is the purpose basically. So modes of transmission over here, let's talk about them. So if you talk about the modes of transmission, basically we are having two important modes. One could be the direct, one could be the indirect mode of transmission. So here, guys, okay, so let's talk about the modes of transmission, right? So either we might be having the direct mode of transmission, either we might be having the indirect mode of transmission, right? Very important, guys. So either we might be having the direct mode of transmission, either we might be having the indirect mode of transmission. Let's talk about them. First one, guys, here we should talk about over here in the direct category. Okay, let me just divide it like this. So what kind of diseases, right, what kind of modes can we see in the direct and what kind of modes can be seen in the indirect? So guys, in the direct one, we might see the direct contact first of all, right? We might see the direct contact. So direct contact can be seen, right? Or you might see the droplet infection, right? Or you might see the contact with the soil, right? Soil contact with soil basically, right? Or you might see the inoculation. Inoculation means through the thorn, okay, through the prick, okay. For an example, through the thorn you might get sporotrichosis, right? or with the needle prick, for an example, you might get HIV or you might get hepatitis, right? So these kind of things, not you, for an example, any kind of person, right? Okay, so inoculation, that term is inoculation. Okay, so inoculation means through the prick or through the thorn prick or something like that, inoculation. Okay, and in the last we shall talk about, that is your vertical transmission, or that is also called as a transplacental transmission. Transplacental transmission. Okay, so let's talk about them over here itself, guys, right? For an example, I'm using the very simple term direct contact, right? Okay, so this is the pen, direct contact, right? This is the mode of transmission. Here there was some infective agent, there was some infection, right? My fingers will be getting the infection from this particular case. This is the direct contact, right? So direct contact, basically in the direct contact, what we are saying, due to the direct touch, right? For example, skin infections, dermatitis, right? Allergic dermatitis, for an example, right? Or scabies is a very common example which you can actually understand from the direct contact. Okay, then you are having your droplet infection, right? For example, you are sneezing. Whenever you are sneezing, you are having the droplets. Okay, those are having the bigger size, and then you are having a droplet nuclei, right? For example, if I am having the sneeze right now, okay, if I am sneezing right now, first of all, I am having the droplets, bigger droplets. These might be having, these might be having the capability to cover the distance of around 30 to 60 centimeter. Okay, and after that there will be very minor droplets. Okay, actually those droplets are called as droplet nuclei, and they can actually travel a lot of distance with the air, right? They might travel even approximately for 50 to 100 meters, right? Who knows? So with the air they can actually flow, right? So basically those bigger droplets can actually infect some other person, right? But the condition is that other person should be coming in with that one person, should be actually coming in contact, or I would say they are actually coming in very close proximity to each other, right? And if one person coughs or sneezes at the same point of time, in this particular condition, due to the transmission of these droplets, okay, respiratory infection might be seen in that another person as well, right? Because now this person will be the reservoir for this patient, and now that infection might grow and then might multiply, and then this person further might transmit this infection to any other host, right? For example, that happened in your COVID times, right? So COVID-19 is a very universal example for all of these kind of terms, right? Okay, coming to the next example, guys, that is your contact with soil, right? For an example, you are planting some, you are doing the planting, or working in the soil basically. So from the soil you might get some infection. For an example, anthrax, right? Tetanus. These are the infections which can come from the soil actually, or from contact with the soil actually, right? So these kind of examples can be considered under this soil contact case. Inoculation, I told you, if there is a thorn prick or if there is a needle prick, okay, and due to that, if somebody is getting this infection, HIV, hepatitis B, okay, that is very common with the needle prick. For example, HIV, if you talk about, there are almost around 5% of chances which can be seen in these particular cases. You might have studied this in the medicine also, right? Or if you talk about the hepatitis infection, right, there are almost around 30% chances that one person might get it, right? One person might get it from the needle prick. So whenever in your clinical postings, or whenever during your internships, or wherever during your residency, be very careful with the needle pricks, right? So always do not try to recap the needle, especially after cannulating the patient, or especially after taking the sampling of the patients, right? So that is very common mistakes by us, which can be done, and without our mistake, basically, one can get this particular infection. Okay, so that is the thing over here. Now coming to the last one, that is the vertical or the transmission. That is vertical or the transplacental transmission. Here the infection might travel from the mother to the baby, right? That is called as vertical transmission, from mother to the baby, right? So here we are talking about in the pregnancy, usually we are talking about the trimester, first trimester, second trimester, third trimester, right? So there are some infection which can transmit from the mother to the baby in the first trimester. There are some other infection which can transmit from mother to the baby in the second trimester, or maybe in the third trimester, right? So let's talk about them. So here I would like to write for this particular vertical or the transplacental transmission. However, you can actually read it in the obs-gynae as well, or in the pediatrics as well. But okay, let's talk about them here as well. So here, let's say in the first trimester, right? In the first trimester, for example, chickenpox or rubella, right? So rubella infection or the chickenpox, right? You might be seeing over there. Okay, they might get transferred, or in the second trimester, or in the third trimester, right? Second trimester, third trimester. In the second trimester, parvovirus can actually travel from mother to the baby, right? In the third trimester, for an example, HIV or maybe hepatitis can actually transfer from mother to the baby, right? So we never know. Okay, so these are the infections which might be actually traveling from mother to the baby. Okay, they are having the high risk in these particular trimester, right? So that is about your vertical or transplacental transmission, right? They are your direct mode of transmission. So be very clear with that. Coming to the indirect mode, guys, let's mention about the indirect mode as well. So again, guys, first one, that is your vehicle borne, right? What is vehicle borne, guys? Again, let me explain it over here itself. So vehicle borne means vehicle is not your vehicle. Like for example, it could be vehicle could be, for example, food, right? So the infective agent will be actually presenting on the food, and you are traveling with the food actually, and it can actually transmit to other kind of places, right? For an example, you are ordering something online, for example, Zomato, Swiggy, and all of these things, right? So the infective agent might be present on that particular food, get traveled to your particular home, right? And then it might be transmitted, right? So that is an example of vehicle-borne disease. Second one, guys, the option, the second one, it could be the vector-borne. Okay, in the vector-borne category, we are talking about two types basically. One is the mechanical type, and another one is the biological type. Another one is the biological type. Okay, I will talk about that few moments, right? Let me talk about the other one as well. Okay, vector-borne, I need to talk about some points over there. Okay, I will talk about that. Next one is the airborne disease. Okay, next one is the airborne disease. Airborne means simply with the air, right? So in the airborne, basically we are talking about the droplet nuclei. Remember, I was giving you the example of coughing or sneezing. I talked about the droplets first of all, and then I talked about the droplet nuclei. Those bigger droplets are coming in the example of direct transmission. But those droplet nuclei, which are very minor, which are very minute, which are very small, which can travel a lot of distance with the air, that will be coming under the indirect mode of transmission. So be very clear with that. The droplet nuclei are coming in the example of modes of transmission. Which one? Indirect mode of transmission, right? Okay, droplet nuclei or dust, very minor dust, which can travel with the air. So that could be the example of airborne. D. Okay, next one which you can see over there, that is your fomite-borne. Fomite-borne means simply any inanimate object, right? Any inanimate object or any non-living object can work like this particular thing, right? For example, there could be one infective agent on some non-living object, right? And that can actually transmitting the infection. That is the fomite-borne infection, right? Non-living basically. And the last one, that is the infection spreading through the unclean hands by using of unclean hands. As I gave you the example earlier as well, when I was talking about the nosocomial infection, do not attend one. Okay, after attending one patient, especially after attending one patient, always disinfect your hand and then attend the second patient, right? Okay, so before attending any kind of patient, okay, you should disinfect your hands always, right? Okay, and again, COVID gave us best example, right? So that told us about many special kind of things. For example, especially the cleaning of the hands, how to clean the hands, or the steps of cleaning of the hands, right? And disinfection points and okay, and whatnot. So these were the important points. So again, guys, unclean hands, if somebody is spreading the infection or the infection is getting transmitted to the unclean hand, that is a indirect mode of transmission, right? Right? For example, you attended one patient, then you attended another patient, then you attended another patient. So you're transmitting the infection from one to another. That is kind of an indirect mode of transmission, right? So again, guys, be very careful while working in the hospital. Always disinfect your hands after attending each and every patient, right? Okay, guys. Now I'm moving on to, I told you that I will be, discussing about this particular example, that was your, vector-borne disease is having two types, mechanical and the biological. So let's talk about that. So guys, I was talking about the vector-borne. So first of all, you should be very clear that I'm talking about the indirect mode of transmission, right? First thing. Now there I told you about two types. First one I told you it was your mechanical type. So mechanical. Okay, mechanical. In the mechanical, very simple. Please do understand that in the mechanical means basically the infective agent is present on the body surface. So infective agent is present on body surface, and if he is spreading the infection, infective agent is present on body surface, and if he is actually presenting on body surface, and if he is actually spreading the infection, okay, this person is spreading the infection, then it is the mechanical host of this vector-borne disease. Second one is your biological, right? Biological mode. Okay, so what do I mean by that in the biological one? So biological means basically this particular, now in this case we are having three important terms, right? What are the three important terms? Yeah, let me write it over here. First one is your propagative type. So propagative. Okay, so first one is your propagative type. Okay, so propagative means over here what I am talking about. Okay, first one is your propagative. Second one is your, okay, cyclo-developmental. Cyclo-developmental. I will talk about the differences. Cyclo-developmental, right? And third one is your cyclopropagative. Third one is your cyclopropagative. Okay, now let's talk about each one of them, right? So these are the types which we might see in the biological methods of vector-borne diseases. Indirect mode of transmission, again I'm emphasizing on that. So propagative type, guys, here we are talking about basically these are the types of biological only, these three types. Propagative type, basically here the infective agent will be going inside the host and will be replicating its number, right? So if there is increase, right, I will use a different color rather. Yes, so if there is increase in number of infective agent in an host, infective agent in a host, right, that is an example of propagative type, right? In the cyclo-developmental, basically we are talking about increase, right, increase, or I would say change in either shape or either form of infective agent in the host, right? And if you talk about the cyclopropagative, basically this is change in number, or I would say, you know, increase or change in both, right? That is your number also, change in shape also, change in shape or change in number, okay, rather I would say and change in shape and change in number, both, right? Change in number of infective agent in a host, right? So that will be the example of cyclopropagative type. Okay, so these are three kinds basically, right? In the propagative one, we shall actually take the example of plague over there, right? In the case of cyclopropagative, we shall take the example of plasmodium in female anopheles, right? This over here I drew the sign of female actually, right? This one. Okay, guys. So these were three types of the biological mode of transmission, or I would say indirect mode of transmission in the vector-borne mode of transmission, right? Okay, guys. Now I'm moving on to the important term over here, that is the timings, right? What are the important timings in the spreading of the infection, guys? Very, very important. We will be closing this session after that. So here, please be with me. So now, come on, guys. We are going to talk about the timings of infectivity, right? Or I would say the timings of spreading of infection. Okay, so these kinds of timings are actually asked very, very frequently, guys. Okay, so let's understand about them as well. So guys, first one over here which I'm gonna mention, that is your incubation period. What is your incubation period? Very frequently you'll be seeing this in your book as IP. Okay, IP. So let's talk about that as well. So incubation period, guys, basically here this is the time between an entry of an organism and signs and symptoms of this particular person, right? So basically I would say that the timing between the entry of an organism to the signs and symptoms, right? So basically this is timing between entry of an organism, this is a sign of between actually, right? Between entry of an infective agent or organism Okay. Timing between entry of an infective agent and signs and symptoms. Signs and symptoms, right? That is called as your incubation period. Okay, so these kind of definitions are coming very frequently in the exams, so be careful with that. Okay, next one is the generation time. Okay, next one is the generation time. Okay, so do not confuse yourself, very easy. In the generation time, basically it looks like incubation period, but it is not, right? Here the host is already infected basically. Okay, so the generation time, basically the time from entry of an organism to the maximum communicability period, right? Timing from, timing from entry of an organism, timing from entry of an organism to maximum communicability of disease. Okay, so that is your generation time. Next one, third one is your, okay, I will use that same pen, red one. Okay, third one is your, what is serial interval? What is serial interval? Okay, so serial interval, guys, be very careful with that. In the serial interval, this is basically the timing between the primary host and the secondary host. I will say the primary case and the secondary case, right? So any time interval between primary case and secondary case. What was the primary case? The first case which is coming in the community, right? Which has been introduced into the community. What was the index case? Right? That was the first case which was coming in, right? Which was coming in, contact with the, not in the contact, I would say, if I am an analyzer, or if I am an epidemiologist, or if I am a physician, if I am getting that particular case, or if I am identifying that particular case, that is the first case, that will be the index case, right? So primary case and secondary case, timing between this primary case and secondary case will be called as the serial interval. So the timing between primary and secondary case, timing between primary and secondary case, that will be your serial interval, right? And I hope you remember about the quarantine and the isolation, guys. What was the difference between quarantine and isolation, which we have talked about earlier in the previous sections? So quarantine was done for the apparently healthy individuals, and isolation is done for the diseased people, right? In the quarantine, I told you that it is the primary level of prevention. Isolation is also the primary level of prevention. Quarantine, I have told you that we are actually doing the quarantine for this person, for the healthy person, for the maximum incubation period known. And I told you for the isolation that the isolation is done for the diseased people for the maximum communicability of the disease, right? Or I would say maximum communicability or maximum period of communicability of any kind of disease, right? Okay, so that was about quarantine and the isolation. Now let's try to apply some knowledge in these particular MCQs as well, guys. Okay, so let's try to look at these MCQs over here. So first one, guys, period between infected host, okay, infected host to the appearance of symptom, infected host to the appearance of symptom. Okay, so here what should be the answer? Answer should be generation time. So do not confuse yourself over here, right? Look at the next question, period of disease initiation to the disease detection. Period of disease initiation to the disease detection, that will be called as your, yes, that will be called as your latent period. That will be called as your latent period. Okay, so please revise these definitions which I've talked about in this particular session. Okay, and if you will be revising it twice, probably you will be easily able to answer these questions, right? First case which comes to the notice of an investigator. Come on, guys. First case which comes to the notice of an investigator or physician or epidemiologist, whatever they can use over there in the question. Yes, I heard it right, that is index case. First case seen by an investigator. First case seen by an investigator, again, that is again your index case. Next question is first case in community, right? First case in community they are asking you, that is your primary case, that is your primary case, right? So these were the different MCQs, guys, which we have discussed in the epidemiology of the infectious disease. I hope you thoroughly enjoyed the session, right? I know this was a longer one, but it will be worthy if you will be going through it thoroughly, right? So try to solve some MCQs after reading this one. I will see you in the next one. Thank you so much.